Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this valuable, you're of course welcome to take it and use it as you see fit. So the exercise I want to demonstrate here is a sort of weighted scapular retraction exercise. I will often progress this once we've done the scapular punch exercise and people have learned how to sort of feel and control their scapula and move it comfortably through a full range of motion. After we do that, we mobilize it and then we start loading it. And I find a lot of people who have particularly shoulder issues, but also neck issues, or also sort of periscapular pain, so pain in and around the shoulder blades. It can often be traced back to, at least in part, to scapular dysfunction. Either the scapula aren't moving properly, or they're moving suboptimally, or they're not strong enough, or the person isn't able to control them well enough. So getting the scapula involved can really help, because then they start to take some of the burden of that part of the body, which is always a good thing. So an easy way to start to load this exercise, hopefully you can see, yep, I'm going to take this not a TheraBand, sort of exercise band thing. This is a nice light one. And all you do is wrap it around something. Obviously, I've got the squat rack here, so that's nice and easy for me. And what we're going to do is we're going to do that same exercise. I'm going to come this way so you can see better. And we do that same exercise, that scapular punch exercise, but now we're going to be loading the retracted position. So as you can see, I'm doing that same scapular punch. I've got a little bit of tension on the band here, and I just protract the scapula and then retract. But now the retraction portion is loaded. Beautiful. So the next step from here, which we'll often go to, is we will then use this as a basis to then inform all of our pulling or rowing patterns when we do some general strength training in the gym. So often a problem people experience is when they start doing row type movements, we sort of pulling things towards you, we kind of just overutilize the arms, and that puts a lot of stress on the shoulder and also in the elbow joint. Can often cause sort of tendinopathies around the elbow, tennis elbow, golfer's elbow, things like that. So the progression from this weighted retraction is I'll then say, break it down. So do the retraction and then do a row. And again, so retraction, row. So you get used to using your shoulder blades, your scapula, when you do rowing movements as part of your exercise program. And then eventually, rather than breaking it down into two movements, we start to combine. So we retract and row all in one. And that's a really nice way to start to strengthen the scapula and start to get it involved in our exercise program. The scapula, it's a really useful part of the body, essential part of the body, but it tends to get kind of lazy. And if we don't remind it that it should be working, often it doesn't work. So that's the weighted scapular retraction exercise. I hope you found that useful, and I'll see you at the clinic.